Hello, and welcome to another episode of Health, Wealth, and Happiness. I'm Jen Cohen. Thank you so much for joining us today. If it makes you healthy, wealthy, or happy, you're going to find it here on Health, Wealth, and Happiness. Today, we're talking with Carol Conti. She is an RT and a CCT. She's a medical imaging professional from Northern Arizona Thermal Imaging. Now, that is a medical thermography imaging center in Cottonwood, Arizona. Carol, thank you for being here.
Thank you for having me.
Yes, you are a lovely lady with a fascinating backstory on how you got involved in this thermal imaging.
Well, I was an X-ray tech and a mammographer for almost 40 years. And when I graduated medical school, which was 1973, our focus was patient-focused care. In the last 10 to 20 years, that has changed and become more corporate. Instead of patient-focused, it's more bottom-line focused. How many can we run through at a time? The last facility I was performing mammograms at, they required that I perform 30 mammograms a day and no overtime. We're not all created equal, so I would have overtime. And they would get really upset with me for that. And yet I felt, you know, I needed to be able to have enough time to be nice, for crying out loud, you know. Anyway, my own naturopath had been trying to get me into thermal imaging for years. And I didn't really believe in it. I thought it was some off-the-wall, woo-woo, you know, something. And so I started researching online. There's over 800 scientific studies that have proven that thermography finds conditions long before you have symptoms. And as I researched, I got more and more interested in it. And I finally decided to go ahead and quit what I was doing, even though that meant losing my insurance and a lot of things, steady income for one, and go into thermography. Bought my first thermal camera from a very reputable source in Florida. They flew out to train me. This takes quite a bit of training, but since I was already a mammographer, I knew how to position the body. So I was pretty much trained in one day. And then the gal says, the trainer, well, let's do a breast exam on you so we know how it feels. Okay. Had it interpreted, came back abnormal. The recommendation was for a 3-month follow-up. So in 3 months, I had my husband push the button. I positioned myself. Excuse me. It came back suspicious or high level of concern. Oh dear, what do I do with this? So I went to the facility that I had been working at as a mammographer and had a digital mammogram that showed absolutely nothing. Well, you don't just take that, you know, as gospel. I then had a breast ultrasound. Whenever a woman has a lump or anything suspicious, we need to follow up with ultrasound. What is it? Ultrasound can show us if it's a fluid-filled cyst. Is it a lymph node or a solid mass? In my case, it was a solid mass. And I then had an ultrasound-guided biopsy, which proved to be a very deadly invasive breast cancer. Oh dear. So it was like getting hit over the head. Thermography works. It finds conditions before you have symptoms. And by the time it would have shown, by the time I would have felt a lump, or it would have shown on a mammogram, it would have possibly spread. Wow. So we caught it early, thank God. And now I am very passionate about thermography as a preventative tool.
Absolutely. Be proactive about your health this
That's
way.
it.
Thank you for sharing your personal story with that. And it really puts a lot behind, you know, the thermal imaging idea. You know, we've discovered, you know, how you got involved in it, and that makes a difference. And with your extensive medical background. So that makes a big difference to me, knowing you are a professional. You know, can you tell us what RT and CCT stands for? RT is radiologic technologist. CCT is certified clinical thermographer. Excellent. So you're certified, and which basically means she knows what she's doing, people. Absolutely. Carol knows what she's doing. And now tell us why it is that thermal imaging will discover things earlier than anything else. Well,
for instance, mammography, ultrasound, MRI, CT, all of those are looking at anatomy. What thermography looks at is physiology. So we're looking at metabolic detail or metabolic changes in the body. That's apples and oranges to what I was used to. And what is amazing is we can see things, you know, changing in the body long before you realize that you have a possible problem. And then we can reverse that so that you don't develop that problem.
Certainly.
Yeah, we can see by micro circulation in the hands, if you're pre-diabetic, long before there's a change in your blood work.
Wow.
You can do something about that.
Right.
And then you come back, we look again, all right, you've cleared it up.
See, I like that versus just how do you feel? How does this new medication make you feel? This is different. These are photographs that you're looking at of inflammation and of things that aren't functioning correctly. You're looking at a map of the body, which I think is so fascinating.
Right. And when we do full bodies, you know, people are supposed to be balanced. One side of the body looks like the other side of the body. And when something is off balance, then we take a closer look at that. You know, what's causing that? And then we do an extensive history evaluation, workup, before I even take the images.
Sure.
So that I can then concentrate on areas of concern. But we also have a standard process.
Okay, very good. Very good. And we just showed a few of the images there, and if you notice the different colors in the body. So when we talk about health and people think of green, just like, oh, well, that's a good healthy color. Well, green is good. Now, if something is blue, we say, oh, it's not quite functioning right because it's cold.
Right.
Correct. And then, of course, red, we all know red is inflammation, and which is usually like, whoop, 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 the alarms are going off. It's amazing that you get a picture of that. It's right there in front of you. You don't have to guess. You don't have to take this and call me in the morning and see what happens. It's right there. And you can do something about it and then come back and see results. It's brilliant.
I have clients, they have blood work that shows that they have inflammation somewhere.
Right.
So they come to me, you know, I have inflammation somewhere. Okay, let's see where it is. And then depending on where it is, then what can you do about it?
Right.
And we also see dysfunction in the body. The thyroid, for instance. If it's cool, then you are low, you're hypothyroid. If it's hot, you're hyperthyroid. If there's a hot spot, that probably should have an ultrasound and then a biopsy.
Yes.
So it's just really interesting, all the different aspects. When I do a full body, for instance, this blew me away. I always have to take images of the soles of the feet. Now, when I was an X-ray tech, I never cared about the soles of the feet because X-ray goes, you know, right through the feet. But we're looking at things like, for instance, how the body is distributing its weight. If you're diabetic, is there any possibility of a foot ulcer forming that you don't know about? And I got a report back that said stomach issues seen in right sole.
Wow.
My doctor was looking at reflexology points. Who knew?
That is great.
Yeah.
It's just amazing. And to start with the full body is the best way to start, because that will pinpoint certain areas in the body. Okay, we want to go in again. We want to check this.
Right.
Now, and this is completely non-invasive. You're completely comfortable. You know, there's no chemicals involved. It's really simple.
There's no contact with the body. There's no radiation. I can do a baby if they'll hold still.
Wow.
I can do young women. I can do pregnant women, nursing women.
Wow.
People ask me to do their pets. Nah, I don't have anybody that can read that, but
we got to get our veterinarians on board.
Yeah,
here.
well, I do have a veterinarian trying to talk me into it, but
nice.
I'm focused on human. Certainly. You know, my camera is an FDA registered human medical thermal camera.
Excellent.
A lot of people are buying military thermal cameras, other type of thermal cameras, and that's not specific enough for human.
Very good. So it's really, we're human, so it's most important.
Correct.
Oh my gosh. Well, we're going to take a quick break, but make sure you check out nazthermal.com, which stands for Northern Arizona Thermal. So nazthermal.com. healthwealth.com, and we're talking with Carol Conti. We'll be right back with more health, wealth, and happiness, so don't go away.
Regrow, repair, replace. Regenerative medicine is the process of creating living, functional tissues to repair or replace tissue or organ function lost due to age, disease, damage, or congenital defects. Dr. Forrest Lanchbury and the team at Sedona Regenerative Medicine specialize in finding relief for patients suffering from chronic pain. Contact Sedona Regenerative Medicine to learn about anti-aging medicines that will help your body heal itself. 928-282-2520 or SedonaRegen.com.
Award-winning Soundbites Grill is an entertainment restaurant located in Uptown Sedona at the Hyatt Pinion Point Resort. Open for lunch and dinner, featuring fresh fish, all-natural hand-cut beef, even a full vegan menu. Family-friendly, open 11:30 to 9, late dining on Friday and Saturday. Soundbites Grill has some of the best views of the Sedona Red Rocks. Offers world-class entertainment, food, fun, and music.
Two things we can count on every year:
a new set of tax rules and great weather here in northern Arizona.
Jackson Hewitt Tax Service, locally owned and operated by Lewis Rice since 1997, is here for you all year long.
Your neighborhood Jackson Hewitt Tax Office will help you in all of your taxing situations.
Electronic filing is always free with your tax preparation at Jackson Hewitt Tax Service.
Get more in return. Call 1-800-234-1040 for an office near you.
Show your customers how much they matter to you. Follow up with a real card in just 60 seconds with Send Out Cards. Send Out Cards makes it easy for busy professionals to leave a memorable impression. Stay in touch with a simple one-step process from your phone or computer to their mailbox. Call Judy today at 928-202-2557. That's 928-202-2557.
Primary health care should emphasize prevention and self-healing through the use of natural therapies. Breakthrough Medicines, Dr. Shada Sina assists patients using naturopathic medicine to facilitate body aging gracefully, detox and weight loss, hormone balancing, and brain wellness. See Dr. Sina for women's health. Find out more about naturopathic medicine and Dr. Shada Sina at breakthrough-medicine.com. Now accepting new patients.
Welcome back to Health, Wealth, and Happiness. We're talking with Carol Conti. She's a medical imaging professional. She's with Northern Arizona Thermal Imaging, and it's the most amazing thing we've been talking about, how it discovers inflammation, how it discovers dysfunction. There's no radiation, there's no contact. It's very safe. It's a wonderful proactive way to take care of your health. Because you mentioned earlier, you take this blood test, or this doctor says, I think you have something somewhere, but we don't know where.
Right.
And then you've got to try all this other stuff until nothing is working. But with a thermal image, you can look at it and say, it's here, bam, right there, and go into it. And you're celebrating a milestone now.
Yes.
You've been in business for 10 years now.
Yes.
So this is not a new thing. This is 10 years.
And this is amazing for me because when I started was at the height of the last recession. As a woman starting her own business, I couldn't get a loan. I mean, on and on and on. And my husband, bless his heart, everything that happened, I had breast cancer, so that put me out of work for a couple months. But everything that happened, my husband says, we've got to hang in for 2 years. No matter what, we've got to hang in for 2 years. May 1st is our 10th anniversary, and I'm having a big party.
Oh, you deserve a big party. 10 years.
Yeah.
And to think of how many lives you've touched in 10 years. A simple thing is coming in and having a thermal image done of anything and showing. And think of how many times you've discovered an illness before it became an illness.
What's really great, in February, I went down to Scottsdale and imaged a whole company, all of their employees.
Wow.
As an annual health benefit for their employees.
Wow.
Yeah, full bodies on everybody, and they're going to do this every year. to make sure that they're self-insured. So they want to maintain the health of their employees. Wow. And I thought that was fabulous. Yes. I'm hoping more companies will come around and think about something like that.
That is brilliant.
And then if we find something, then you go on and do, you know, whatever you need to follow up.
Right. Now that's wonderful. What kind of things does the thermal image show you as far as when you see inflammation or dysfunction in certain things? What type of things are you seeing?
You know, what's really interesting is we can see toxins in the body.
Really?
Yeah. And then we tell you what to do, you know, to try to get rid of those toxins. We give you instructions on dry skin brushing, for instance. We can see hormone imbalance. Wow. And that's a huge precursor to a number of cancers, including prostate cancer. Wow. Is hormone imbalance. So we see these things in the body that can be reversed to keep you healthy. If we see something like, oh, your heart is cooler than it should be, well, then we've got to look for a blockage somewhere. You need another test to see what's going on, because your heart should not be cool.
It should not be blue like the guy in the picture.
Right, exactly. And we can tell, you know, abnormal blood vessel patterns. So that really points to things that are happening in the body. When we look at the head and neck, we look for dental issues because we can see below the gums. We can see infection going into the body. And dental infections are a huge forerunner of cardiovascular disease.
Yes.
And we can see underneath dental implants and root canals. And sometimes we'll see a lymphatic drainage pattern going into a breast. And we'll go, you've got to, you know, you got to take care of that, because that's going to end up in a possible breast cancer.
Wow.
Yeah, and I've seen this, and it's pretty amazing.
Wow.
We see not only the large intestine when we do the abdomen, but we see the small bowel as well. And we can see if there's dysfunction somewhere in the small bowel or inflammation. Gallbladder, liver. Liver's huge because the liver is a filter of toxins in our body. So we like to look at the liver. In fact, sometimes we look at the liver even when we're just doing a breast exam. We can tell how your immune system is working.
Wow.
Yeah, with a simple breast exam, I always check the immune system.
Wow.
Yeah, so there's so many different things that we can see on a thermogram. That's why the reports are lengthy and really comprehensive. And the reports that you get back, and every client gets their report, includes the images. So you can see something showing here. You can look at your images and see where that is and what it looks like.
Which is nice, because a lot of times when you have x-rays or CT scans or something, they don't show you those
No,
things.
it just says normal.
They go, you're fine. Meanwhile, there's wait a minute, doc, there's a screwdriver right there. Did anybody notice that?
Right.
Now, who is doing the reports? Who is looking at the images?
I have a medical doctor, and she is actually a holistic medical doctor in New Mexico that reads my exams for me. My exam turnaround from the time that you have your exam till you have the report in your hands is 72 hours or less.
Wow.
If I put a priority on it, I'll have it back the same day.
Oh my gosh. You get a blood test done, it takes 2 weeks to get your results.
Right.
You know, a simple swab at the doctor's, cheek swab. 2 weeks later, you find, oh, by the way,
exactly.
you're dead.
and a biopsy.
Yes.
You know, been there, done that, have the T-shirt.
I bet.
So you're chewing off your fingernails waiting for the results.
Right. Those weeks of waiting or those days, and now it's just hours with you. That's amazing that you have that turnaround for people.
So then we find something, and then we use thermography to monitor. You know, is it getting worse? Is it getting better? Are we improving, or has something new started? I scan my husband every year on Father's Day.
Oh, nice.
I do a full body because I want him healthy. Okay,
Yes.
He takes care of me, so I want him healthy. So I do a full body on him, and we discovered some bad root canals just using thermography. Wow. So he had those pulled, and he said, I feel like a new man after
Right.
having those removed.
Of course, it's a poison in the body.
Exactly.
You know, any sort of toxin or any sort of infection just keeps
Right.
slowly poisoning you, which affects everything. I mean, how do you feel this morning when you got up? Do you feel great this morning, or do you feel like, oh, well,
Yeah.
that could be something that could be seen with thermal imaging.
Exactly.
Amazing that it sees inflammation, it sees dysfunction and circulation and toxins.
Yeah.
Everything.
Yeah.
This sounds like something that is not something just to do when you don't feel well. It's something you need to do often.
Well, this is my
Regularly.
main point. Is I like to image healthy people. We are a health maintenance, technology. So we'd like to see you healthy and maintain your health. If you have a problem, go to the ER or, go to your doctor. But if you want to maintain your health and wellness, come to me. Now, with mammography nowadays, if a woman has dense breast tissue, she gets a letter that says mammography alone is not enough, you need something else, and they recommend ultrasound and MRI. I recommend thermography, okay, because dense breast tissue doesn't matter. Breast implants don't matter. We see around them. We see through dense tissue. So those kinds of things we're in addition to help.
Right, and then of course with the mammography, there's no squishing
Right,
involved.
with us.
There's none of that pain.
Or
Sorry guys,
radiation.
but hey ladies, you know what I'm talking about.
Yeah.
Mammographies are not the most comfortable things. Nobody looks forward to that. But with a thermal
Right.
image, it's non-invasive. There's plenty of space. They're not smushing you or doing anything like that.
Right, we don't touch the body.
Yeah, that's great. So
Yeah.
so any sort of phobia or fear is not going to be activated with
And
this.
for, the full body, the half body, or just the abdomen alone, there's no fasting. One prerequisite, when we do the head and neck, I don't want you to hold your cell phone up to your ear for 2 hours before your exam.
Oh,
Because we
fascinating.
see the inflammation caused by cell phone use.
Yes, that is true.
And I've got a young woman right now that's supposed to be back this week to check because we saw something really suspicious in her breast. That's where
She keeps her cell phone
cell
there.
phone in her bra.
Oh,
so
dear.
she was told,
Oh,
stop that,
that.
and let's make sure that that's what it
my
was.
God. Wow.
Well,
Well, we're going to take another quick break, but make sure you go to nazthermal.com for more information. Lots of great images there, lots of ways to get in touch, and all the things thermal imaging. Check it out, nazthermal.com. We'll be right back.
Been hearing about the crazy benefits of CBD? Find out how CBD can help you at Sedona's #1 resource, CBD Sedona. Come in for a free consultation and let our trained medical staff help you find the perfect product for you. Pain relieving salves, full spectrum oils, honeys, teas, cookies, and even CBD for pets. Ready to feel fantastic? Come on by CBD Sedona today.
Parents, you know as well as I do, there's nothing more important than your children. Don't you love to look in their eyes and see the love? Make sure they can see that love in your eyes by having their eyes examined. You can't tell how well your kids see, but Dr. Houston at Camp Verde Eye Care certainly can. Call 567-3330 to make an appointment. You'll be glad you did. Camp Verde Eye Care at 567-3330. They really do care.
Northern Arizona Thermal Imaging uses a state-of-the-art medical digital camera to take a picture and create a map of the body's infrared patterns, later interpreted by an MD specially trained in reading thermography. Northern Arizona Thermal Imaging is the leading medical imaging and proactive healthcare, detecting early danger signs years before other tools, finding early breast disease up to 8 years before mammography may detect it. Schedule a scan with Carol today. Northern Arizona Thermal Imaging. Say yes to thermography. Metaphysics. What does it mean? It's a branch of philosophy, literally beyond the science of matter. Sedona's University of Metaphysics studies the ultimate nature of existence, reality, and experience. Join 14,000 graduates in over 120 countries, helping others in counseling, coaching, ministry, and much more. The University of Metaphysics is here to serve the best in you so you can serve the best in others. universityofmetaphysics.com.
Start your journey toward better health with Ageless Touches Massage Therapy. Licensed massage therapist Richard Stevens uses the latest and best equipment to relieve scar tissue, electronic smog, and tinnitus. Ageless Touches does everything they can to work your issues down to the bone. Improve your path to better health with Ageless Touches Massage.
Solid Rock Fitness is a one-on-one fitness studio specializing in fitness over 50. I train older adults of all fitness levels, from athletes and avid sports participants to folks with chronic pain to those recovering from surgeries. You and I will focus on strength training to improve overall muscle tone, core conditioning, balance, agility, flexibility, and nutrition. Mastery of these components of fitness will help you live your life to the fullest with confidence and competence.
To Health, Wealth, and Happiness. I'm Jen Cohen. We're talking with Carol Conti. She is a medical imaging professional. She's got this wonderful thermal imaging thing we've been talking about at Northern Arizona Thermal. It's a medical thermography imaging center in Cottonwood. It is a very sensitive and specific imaging method that's computerized, and it gives you a color map of your body and shows inflammation, dysfunction, all kinds of precursors to things that aren't going to even show up yet at your doctor's office. Definitely something everyone should do often. Now, often, I say often, once a year?
Yes.
Okay.
I like once a year so we can find something when it happens. You know, like I said, I like to monitor year by year what's going on in your body. I also like to start with young women doing breast studies. I'd like to start at 15. Now, there's an 8-year-old in Utah with breast cancer. So if there's breast cancer in the family, maybe we should even start younger. But we can tell if the young woman is developing properly, if there are toxins in her body that are built up that can lead to problems down the line, hormone imbalances, all of that. And I get to educate. When we start young women, I get to teach them self-exam. I get to educate them about their bodies. We don't do annuals on women that young, but say start at 15 and every 3 years, 5 years, just to make sure that you're developing properly and nothing is going on that warrants further testing.
Well, certainly. So it sounds like anyone of any age, as you say, a baby if it'll stand still,
right,
or she, up until if there's any sort of thought that something's a little off, it's wonderful. If the doctor says, wow, we're watching this, great, come in. Or, hey, I think I feel great. Well, let's go see if we feel great.
I have a 93-year-old that comes to me every 6 months. She is maintaining her health.
Oh, nice.
And I love it.
Maintaining your health.
Yep.
That's great. This is a wonderful way to maintain your health. It's non-invasive. There's no chemicals. There's no radiation. There's no close contact. There's no pain involved.
No.
It is super easy, simple. You get the full report and the map that shows you can look at the results yourself, which I love. It's not kept secret. No, you can't see this. You're allowed to see it.
Right.
Now, that's wonderful. The best way for someone to contact you?
Through my website. You can even schedule your appointment on my website.
Very nice.
Or by calling us at 928-852-7579. I usually answer the phone. If I'm not answering the phone, then I'm with a client. So please leave a message and I'll get back to you.
Very good. And your hours?
Our hours are by appointment.
Oh, nice.
When I started, I was using other people's offices, so I was having to use their hours.
I see.
Well, when I worked full time, I worked 8 to 5.
You understand
I
that.
couldn't get anything done during the week. So I will, if a woman says I need a breast study and I get off work in Sedona at 5, I'll see her at 5:30 in my office here.
That's wonderful that you're willing to do
Weekends.
that for people.
I also have satellite offices in Flagstaff and Prescott.
Good to know.
And in Prescott, I'm there every second Saturday of the month.
Okay.
In Flagstaff, I'm using somebody else's office, so I have limited hours.
Okay, but if you go to the website,
right,
absolutely, nazthermal.com. You want to get a hold of Carol, that's where is a great way to start, nazthermal.com. Carol, thank you so much.
You're very welcome.
Congratulations on your 10 years.
Thank you so much.
That's all the time we have for Health, Wealth, and Happiness. We'll see you again next time.